Welcome to our community. We're all about lifelong learning, evidence-based interventions, collaboration, personal development, and clinical excellence. Our approach is founded on functional medicine, but also acknowledges that personal intuition and the experiences we and others have had also inform our clinical decision-making. Altogether, these factors create wisdom, which incorporates knowledge, intuition, and experience. Therefore, we aspire to teach our clients what we call wise wellness and run our practice with wise choices. That being said, the science that informs functional medicine is our bedrock. So let's get a refresher on just what functional medicine is, because it's not what you're typically seeing from those who call themselves functional medicine providers. Unfortunately, because this sector of healthcare is so effective and has become wildly in demand, marketers and profit-hungry businesses have slapped the label on their services that are far from the concept. The influx into the field of practitioners who took a course on a stool test and call themselves a functional doctor has largely twisted and diluted the practice of it. My original professional training, and those of the staff at my practice, was in functional medicine itself, taught by affiliates of the Institute for Functional Medicine. Therefore, we know it thoroughly and have used their research and principles as the foundation for our protocols. We believe strongly this is one of the reasons our services resonate so deeply with clients and they get such great results. At the core of functional medicine is a reliance on diet and lifestyle to reach health goals in pursuit of the deepest root causes. Someone giving berberine or chromium as the intervention for an abnormal blood sugar is really practicing what I call green pharmacy. Someone lowering the glycemic load of the diet, increasing movement, improving the gut metabolism, and lowering stress hormones to improve blood sugar is really practicing functional medicine. We've never used a supplement for blood sugar at our practice, and we've always been able to normalize A1C with anyone who follows the plan. Same with cholesterol. We'll get into what the deepest root causes often are in the next lesson. Our approach is also different from what you'll commonly see because we have a mission to make functional medicine/wellness accessible to as many as possible and as low stress as possible. Therefore, we don't start with big panels of functional medicine tests or 10 supplements or a very restrictive diet. We only start with the minimum necessary to give us a great chance of reaching their goals. If running that test won't change the current treatment plan, if what we're going to implement anyways has the ability to make that marker healthy, then we don't run it. This helps reduce not only the time and financial stress, but also the stress of finding out something negative about your body. To a client who only understands disease, because that's the traditional model and how it works, an abnormal result can feel like a lifelong sentence or a serious problem that could be putting them at risk of something scary. They often file that away as yet another way in which their body has betrayed or failed them, feeling as if they'll have to fight against it forever. We hear this all the time from clients who come from other providers when they're trying to make sense of their symptoms. Some examples. They might say, maybe I still have that parasite from 2 years ago that's stealing all my nutrients and giving me leaky gut. Or 2, oh no, I never eat avocados. They were positive on a food test 10 years ago. Or 3, well, of course, that's because my body can't detox because I have MTHFR. Let's not be those practitioners. Let's only get more complex and give more labels of dysfunctions and give more supplements because we've proven it's necessary by first doing all of the other interventions that give the body what it needs in order to heal. We've found that about 75% of clients don't need any functional medicine or unconventional testing. Simple blood work combined with really paying attention and asking good questions at their evaluation will reveal most of what you need to know for them to make huge strides in their health. if not reach all their goals. And even when you do use functional medicine testing or fancy supplement protocols, you'll do so knowing it's just to give the body that final push into their healing. It's all the other changes you've made that will sustain the results. Because in the end, what shows up on a functional test is a result of a more upstream, deeper root cause that allowed abnormality to be there. Treating the test results, even though it may be a root cause or trigger, won't truly treat the original dysfunction. I'm sad to say that with the many patients I've evaluated who saw a functional provider before me, none of them could articulate their root causes, nor have I ever seen them written on the FACS records. Fortunately, your journey through this course will correct this disservice to clients in the name of functional medicine. If you're just a bit curious about what it's like to have thousands of answers at your fingertips and a group of practitioners at your side, I recorded a tour of the experience inside our academy. This will give you a sneak peek about what it's like to be part of our community. No pressure, no pitch fest, just insights, tools, and takeaways to help you practice with more purpose and clarity. I'd love to welcome you inside the Functional Practitioner Academy. Click the link in the description for more.